Hello, I'm Dr. Jagdish Hiremath. I'm a practicing cardiologist in Ruby Hall Clinic, Pune. Today we are going to look at some information related to high blood pressure and family history. The commonly asked question is whether it runs in families or not. Hypertension does run in the families. If the first degree relative, that is mother, father, brother, sister, any one of them is suffering from hypertension or has received some treatment for it under the age of 60, then it becomes an important family history. Suppose one is suffering, then my chances of developing hypertension are twice as compared to somebody who doesn't have this history. Suppose two or more are suffering, then it is a strong family history, and then my chances of suffering are a little higher. Why this occurs, why it runs in the families is because genetically the same genes get transmitted. So obviously you're going to get exposed to hypertension. These genes are also salt sensitive genes. That means for the amount of salt one takes, there is more rise of blood pressure as compared to the others. So this is the genetic component of hypertension. But there is an environmental component. That means the same family can get exposed to similar food which is high salt intake food, or obesity can be around, lack of exercise as an attitude in the family, or high strung individuals in the family. All these are actually little environmental factors. So genetic factor as in genes and salt sensitivity, and environmental factors as we just saw, both of them together makes me prone as compared to somebody else who doesn't have that kind of a history for hypertension. If I have a chance of developing hypertension twice as much as someone who doesn't have a family history, or more if I have a strong family history, then it just doesn't stop at that. It also makes me prone to develop high cholesterol, diabetes, and other aspects of hypertension, because so many of these risk factors come in clusters. Not only that, they don't get added to each other, they give an exponential increase in risk. So the moment I have a family history of hypertension, I have to be on guard from a very early age and start looking at prevention of its complications or prevention of development of hypertension. And yes, actually prevention is very much possible, because finally it doesn't 100% tells you that it doesn't 100% tell you that there is going to be hypertension in you. Suppose the checks are done early enough and risk factors like obesity is controlled, salt intake can be common sense use of salt control, use of some exercise, yoga, meditation, overall a good lifestyle which prevents hypertension. If it is practiced from an early age in a person who has family history, then it can certainly be prevented, and if further checks are maintained, then it can be diagnosed at a very early age. Beyond this, after following all this, or because not following all this, if you develop hypertension, then of course it should be treated by a proper healthcare specialist. Hypertension treatment is very easy. The worst thing you can do is neglect it. So if you develop one, probably go ahead and get it treated. It's a simple problem to live with. It's like wearing specs, 33% of population. You have just to learn to live with it rather than try to fight it and rather try to overcome it. We'll see some information related to high blood pressure developing during pregnancy. Now, generally, pregnant women are fairly young, and at that stage, imagining hypertension is difficult. But yes, it is a reality. Almost 10% of all pregnant women develop hypertension during pregnancies. There are various categories of that hypertension. That one is called chronic hypertension. That means the lady has hypertension before she gets pregnant and then continues into the pregnant phase. The second one, dangerous one, is called preeclampsia, in which the lady starts developing hypertension in the latter part of the pregnancy. It can be a volatile kind of hypertension. It can shoot the blood pressures very high, produce problems to the baby and also problems to the mother. A placenta, which is a interface between the mother and the baby, can get disrupted because of this condition. Very high pressures can affect the mother and the baby both. And eclampsia of pregnancy is in fact considered a malignant kind of a complication. Of course, this is fully treatable, and the third form of hypertension which commonly occurs is called as a gestational hypertension. That means, again, it starts with the pregnancy. The lady is not hypertensive before that, and then as the pregnancy progresses, there is a definite hypertension which needs treatment. The last two, that means the eclampsia and the gestational hypertension, generally wanes down. That means that as soon as the baby is delivered, this hypertension is expected to return back to normal. But 10% of these ladies can continue to be hypertensive, and somehow they are not diagnosed later in life because the baby is born, everybody is busy with the baby, the mother is young and healthy otherwise, so blood pressure is not checked very often. And then for years together, these ladies can remain undetected. All the same, these two, gestational hypertension and preeclampsia, are the ones which need to be treated during pregnancy, and most of them, almost 90% of them, would become completely normal once the baby is delivered. Chronic hypertension, however, will continue even after the baby is delivered. In general, blood pressure becomes lower in a lady when she becomes pregnant, but when it remains above 130/90 millimeters of mercury, it is diagnosed as hypertension. Hypertension as such in pregnant women is not a welcome thing at all, because it not only affects the mother, but it can affect the baby as well. It could lead to low birth weight babies, or it could lead to premature deliveries. It could lead to more cesarean section babies. So all these complications related to the pregnancy and delivery can take place if there is hypertension in the pregnant woman. Risk of a pregnant lady, like who will develop hypertension in pregnancy, these are all common sense based things. Like somebody who has hypertension already, chronic hypertension, will continue to be hypertensive. Obese ladies, twin or multiple pregnancies type of a ladies, or those with kidney disease, or those who have high blood pressure even before getting pregnant, those who have diabetes, those who are kidney disease, all these ladies can become hypertensive during the pregnancy. So these are the individuals who can get pregnant. There are three types of hypertension. They lead to these form of complications. The treatment of hypertension is important. First of all, early diagnosis is usually made because most ladies are covered medically from the very early part of their pregnancy. The medicines that we use to treat hypertension have to be, into quotes, pregnancy safe. That means they are not only safe for the mother, but also safe for the babies. Here the choice becomes very little. We have to work through 3 or 4 medicines only and keep the pressure at best to 120/80 millimeters of mercury. Once that is achieved, the pregnancy and the delivery can be safe. The commonly asked question is whether the blood pressure in pregnancy be prevented. Yes, it is. We have to make every effort. And again, the preventive methods are based on a lot of common sense and discipline. Control of weight, control of salt, regular exercises, especially yoga and meditation. All these will definitely help relieve or ease the hypertension a little bit. It might reduce a dose or two of a drug that you are taking, but if it is there, it needs to be addressed fairly and squarely. And if treated well, the pregnant lady and the baby can be very safe.